Welcome to another episode of Exercise Matters with me, Randall Cooper.
And me, Mick Hughes.
Support from today's episode comes from Premax Performance Skincare. If you're active, you focus on strength, endurance and recovery. But what about your skin? Sweat, friction and the elements take a toll. That's where Premax comes in. High-performance skincare made for high-performance people. From recovery creams to anti-chafe balms, massage creams to exercise-specific barrier creams, we help your skin go the distance. Keep your skin as fit as your body with Premax. Available now at premax.co.
And support for today's episode also comes from Physio. Health professionals, are you staying ahead of the game? Learn Physio brings you cutting-edge education from world-class experts in sports and musculoskeletal medicine. Online courses, hands-on practicals and expert resources, backed by the latest evidence and designed to fit into your busy schedule. To be your best, learn from the best. Get started today at learn.physio. Well, mate, here we are again for round two. We haven't been sacked or pulled off the air from via the first one.
Well, as we record this, Mick, we haven't published the first one, so who knows what could happen.
Mate, this could be a very short podcast series. Who knows? Who knows what could happen? No, we're not as controversial as some of those other ones out there, mate. No. So it's we're very vanilla.
Centralists here, yeah.
That's it. Well, mate, today's we're covering a topic that's very close to both our hearts, and it's going to be on the topic of prehab exercises, or what's probably more commonly known as injury prevention programs. Huge topic, a big topic to cover, and obviously in 30 minutes we're not going to be able to cover everything, but we'll do our best to cover off the biggest chunks of information that are going to be helpful and wide-reaching to as many people as possible, not only physios, but any kind of other health professionals involved in sport, but importantly, any players, coaches, any parents who are also involved in team sport and individuals activities too, like running, because there's a whole heap of runners out there that like to injure themselves.
And I think when you go back, I mean, I reflect back on early in my career, and at the start, there was no such thing as injury prevention. It might have been a good warm up and stretching, but when it came to any of these exercises, and particularly we're going to talk about in another episode, musculoskeletal screenings, none of that existed. And it was only about in the last 15 to 20 years that A, it started to emerge, and B, the research has started to kind of catch up as a result. So I think it's important for us to recognize, and also for the listeners to acknowledge, that this is an emerging science, and the research is kind of coming. And I think as preventative health continues to grow, we'll see this, particularly gather more importance for us in our industry also.
Yeah, agree. And I think it's fascinating too, having been involved in sport at the coalface as a sports physio, going to training sessions with amateur clubs and local teams, and all the way from junior kids all the way up to reasonably senior levels. The absence of awareness that people have got at a recreational level and at a community level that these programs exist is mind-boggling. They're just, for us as health professionals, they're often front of mind. Like we know about them. We know that these programs exist and these exercises exist, and we know how effective they are. But to the wider general population, they're not known. And when you have these conversations with coaches and parents and players, it's just like, to them, it's amazing that something like this can exist, because especially if they've experienced some significant serious injuries within their club, to know that there's actually something there to help them is quite nice. So yeah, it's a low-hanging fruit that we can definitely get in front of more eyes and more ears.
It is an issue. And I mean, dissemination and uptake, and I know that we'll talk about this as the podcast kind of goes on, but whether you're a 16-year-old netballer or footballer, or you're a 35, 45-year-old runner, for instance, injury prevention does matter, but getting the message to those people of what to do and how to do it, and also packaging it up. So when people say, I'm going to give you an injury prevention program, a lot of people yawn and go, I haven't got time for that. But if you integrate it into their existing program, and then you can also rebadge it a little bit, saying this is going to help with your performance as much as it is going to help prevent possible injuries, then that can be appealing.
Yeah, agree. And before we probably dive right into it, it's often the performance, from my own experience, is definitely the selling it as a performance program usually creates a little bit more buy-in than the others. And the other interesting kind of pushback we often get, particularly maybe at an amateur club or even at a more professional level, is the term injury prevention program. It kind of, to some people, it alludes to the fact that it will prevent all injuries. And that's where some people really get their nose out of joint about how it is termed. But in the reality is, and I certainly was on that side of the fence for a number of years, we can't be calling these, things injury prevention programs, because they will happen. An injury prevented via these programs is still one prevented. Yes, we can't prevent all of them, but we can certainly prevent a lot of injuries from occurring by utilising this program. So I think there certainly just needs to be some clarity. If we are going to sort of give these programs or these exercises to people, we just need to probably finish off that conversation with, look, injuries unfortunately will still happen, but these programs are going to reduce them significantly if we just do them. So that in mind, with such a beast of a topic, I think it's important we probably just sort of, come out and say, look, in today's podcast, we're going to be talking about mostly what are the main types of injuries that can be prevented with these prehab exercises or injury prevention programs. Outside of ACL, because the ACL is one of the biggest areas that this literature is often pointed towards, and we've covered it to death already. So we're not going to take a huge dive into ACLs. It's if we want to sort of extend on that a little bit more beyond the scope of ACL. So side note, they do reduce ACLs by 50%. The second part is,
though, I think it's important to acknowledge though that we do, as much as we don't want to exclusively talk about ACLs, when it comes to the evidence that's in the literature, the bulk of the evidence is around ACLs. So I think ACLs, preventing ACL injuries, has led the charge. It shows what can be done. And then if we can apply similar research and understandings to shoulders, backs, necks, hips, other knee injuries, ankles, etc., then happy days. Then we can really get a robust, holistic program together and not just focus on one little ligament.
Yes, exactly. And lucky for all the listeners, we've got some information to share with you guys about that. Point number 2 that we're going to tick off today, are there any key components to these programs that add to the program's success? So I think that's an important one. And lastly, covering off, does the timing of the programs matter? Because often there is this kind of assumption that these programs are effectively a warm-up and they're most effective as a warm-up, but there's certainly some interesting research out there that suggests otherwise. So they're the 3 big ticket items that we'll cover off today, mate. How do you think about that?
I think that's good. I think they're the most important things to discuss. So let's get into it. What muscle group or what injury do you want to talk about first?
We'll tick off hamstrings first. These hamstrings are a huge problem. Hamstring muscle strain injuries are a huge time loss injury in our AFL sporting code, soccer, football, whichever way you like to call it worldwide. It's a huge injury burden. Lately in the NFL, our American colleagues have also to experience, increasing numbers of hamstring strains, not only in NFL, but also track and field athletes. Basketball, both NBA and both here locally in the NBL, there's been rises in the amount of hamstring strains. And cricket in the 2020 game, there's been skyrocketing hamstring strains. Yeah, it is. So basically, the hamstring it's a speed-based injury. And as the games evolve, any sport worldwide where there's enough distance where you can build up to max speed, we're potentially running the gauntlet with significant hamstring strain. The good thing is there's preventative exercises out there that help. Great work from Van Dyke and colleagues back in 2019 showed that the regular implementation of Nordic hamstring curl exercises can reduce the risk of hamstring strains by at least 50%. And that's just one paper. There's been many others around it. And that to me sort of speaks volumes, because it's such a easy to perform exercise that requires very little equipment. It actually requires no equipment. It just requires a partner to hold the person's ankles down, and it can be done at home, Mick, on the field.
You and I know what it is, but maybe describe it for people who are listening and aren't familiar with the Nordic curls.
Yeah, so the Russian Nordic curls, or the Nordic curls as they've previously termed, basically has the athlete or the person kneeling on their knee. They have a partner behind them grabbing onto their ankles and anchoring their ankles down to the ground. Now, the person that is kneeling will have their arms across their chest and slowly fall forward to the ground, trying to do so as slowly as possible initially so they can build up some strength. It's really hard.
It is
It's
hard.
really, really hard. And most commonly, people will sort of only get maybe 20 degrees down towards the ground before their hamstrings just sort of not give out and break, but they'll certainly get to a point where they can't hold that contraction any longer and they'll just fall almost face first to the ground. But the challenge is for them to sort of try to progressively go lower and lower to the ground to build up their what's termed eccentric strength, which we know is an important feature to injury prevention. So Nordics certainly play a huge role in reducing the hamstring injury burden.
So the statistic that's kind of thrown around, I know you've got it here in kind of like our notes that we're reading off, but it's 40 to 50% reduction in hamstring injuries. Well, it's significant, and that is something that requires a lot of investment in time, and we're going to talk about the implementation of these exercises as well. But my question is it just the Nordics themselves? Is this the magic exercise, or is it just really good eccentric hamstring strength requiring, more knee dominant knee flexion exercise versus a hip hinging exercise? Is that the key? What do you think, Mick?
Yeah, it appears, and I've spoken to some very clever people, much more clever than me, about this in the past, and it seems to be it's the eccentric stimulus that is the thing that matters the most. So David Opar, Ryan Timmons, all these really great hamstring researchers and gurus, had conversations with them, and it is the eccentric stimulus that matters the most. And that can come in the form of a hamstring curl if we focus on the eccentric component. It can come in the form of a slider exercise where we focus on that eccentric component. The thing about the Nordics is it's so convenient. You don't need any equipment. You don't need any special surfaces. You don't need anything. It's just such a adaptable exercise that can be done anywhere, not to mention the fact that it's bloody hard. If you were to do a hamstring curl on a hamstring curl machine, there can be a tendency for you to underload that exercise. So the intensity of the eccentric stimulus is not there. And same thing with a slider exercise where you're basically in a bridge position and you are with your heels in really close to your bum. You're basically allowing your heels to slide out. That stimulus versus a Nordic stimulus where you have to basically fight gravity, it's just not there. So that's kind of like where we land. Also too, and this is where a lot of people do get their nose out of joint, is sprinting and regular exposure to sprinting also too puts an eccentric stimulus on the hamstrings.
Of course it does.
Of a really significant intensity as well. So yes, to answer the question, Nordics are not the magic bullet. It's the stimulus that matters the most. And certainly in our high-speed running athletes, the second additional component that needs to be regularly done as well is that regular exposure to sprinting throughout their pre-seasons and in-season as well.
Great. Well, Nordics work. Eccentric hamstring strengthening is good. I think probably the final point I'd like to make is that none needs to be done in a progressive way. So if you haven't done many hamstring exercises in the past and you want to build up to it, just don't start off and try and do 8 Nordics. Build up to it over a period of time, but those exercises and the high level ones are the ones to kind of focus on. Do you want to move on to adductors, Mick?
Yeah, perfect. Just before I do though, the good thing about the Nordics is also too, once you've built up, and just to add to what you've just said, that once you've built yourself up to an effective tolerance, so there are programs out there that say, let's work our way slowly up to 3 sets of 10. Once you've effectively worked up to that period of time, and it's about maintaining, and you can maintain the length of your hamstring and the strength of your hamstring with just 1 exposure per week, 2 sets of 4 was a nice paper that came out a few years ago too. So it's not as if you have to constantly have this really high load and fatiguing load in your system. So yeah, just one little closing point there.
Good point.
Adductors, significant injury number 2 in a lot of sporting
Muscles
codes.
on the inside of your groin, if you don't know where the adductors are.
The hip adductors. So yeah, groin musculature. So we're talking once again, high injury burden in soccer players, AFL players, NFL players, pick a sporting code. And whenever there's changing of direction and aggressive, sharp turning change of direction, we're going to run occasionally into these injuries. And probably the biggest adductor related injury at the moment are 2 in particular, Anthony Davis in the NBA with the Dallas Mavericks, and his old good mate LeBron James have both significantly injured their adductors in the last couple of weeks, which has led to some significant time off.
Exactly. And I think that the takeaway is that if you're in a change of direction sport that requires side to side and agility movements, basketball clearly, tennis is another great one.
It's up there. Tennis.
It's up there.
Exactly.
You need good, strong adductor muscles to make sure that they aren't injured.
Yep. So good news. Always got good news. I'm always trying to shine a little rainbow of colour, like my background here.
It is. If people are watching it, you've got the background to match.
There's a wonderful exercise, and in keeping with the European names and the popularity of the European names, we've got Copenhagen's. So Copenhagen adductor strengthening exercises have also been shown to be highly effective in improving the eccentric strength of the adductor muscle group, to the point where in a group of football players / soccer players, we're seeing injury reductions of at least 40% when the Copenhagen adductor strengthening program is being done on a regular basis. The adductor program actually comes in 3 different levels, and that's one of the beauties of the program is that we start on level 1, where the person effectively is lying on their side and their affected leg is laying on the ground, and they're slowly trying to adduct their bottom leg up towards the ceiling. So the top leg's moved out of the road, their bottom leg is moving up towards the ceiling, keeping their leg as straight as possible to get a hip adduction movement. Now that's level 1. Level 2 is we're getting up into a side plank position with the person resting their top leg, so their affected leg now this time is going to be the working leg, and it's actually going to be on top of a bench or a chair or a table at the level of the knee. So we've got a short-lengthened muscle, and we're now going to be trying to prop ourselves up and bring ourselves down, propping ourselves up and bringing ourselves down to try and train that adductor muscle to work strongly, but not as strong as we move on to level 3. Now, level 3 is that same position, but now the table or the chair or whatever it is at the level of the ankle. Okay, so now that long lever is making those adductor muscles work really, really hard, and the person props themselves up and brings themselves down repeatedly. So that's the Copenhagen adductor strengthening program, shown to be very, very effective in our, football athletes in this case. Absolutely can and should be applied to other sporting codes.
And I think for me, it's a very similar realm to the Nordics in that particularly that stage 3 exercise is very challenging. If you haven't done it before, I'd suggest don't try that one to start with. You really want to go through, we call them the Jane Fondas, the first one, but then kind of progressing up through those series. I think that's a takeaway for me for both the Nordics and then also the adductor stuff, is that to really get into that high level kind of injury prevention zone, for a better way of describing it, it needs to be high load, and you need long lever arms. It needs to be really challenging for those muscles, and that eccentric component seems to be crucial also.
Yeah. And much like the argument about Nordics being, are they the be all and end all, and are they the actual key to success? And I think with Copenhagen's, I think the same is the response. It's more so the eccentric stimulus is the vehicle. So yes, we could be doing other adductor eccentric loaded exercises like a slider, where you're standing on one leg and you've got something slippery underneath your foot and you're basically sliding your hip into an abductor position, but the load comes through the adductors, and then you try and bring it in. That can be done in standing, but once again, you need something slippery, so it's not going to work at a sporting field on the grass or a basketball court if you have to go barefoot, or we have to go socks or something like that to make it a bit slippery. But soccer athletes in particular, on a grass surface, that exercise won't work in that particular situation. So the Copenhagen, being user-friendly, no equipment required other than a partner or a chair or a table, is a great stimulus to get that eccentric load through the adductors.
All right, let's work our way down the lower limb for the moment anyway, and we're going to talk about ankles and balance and proprioception. Do you want to kind of tell us about that one, Mick?
Yeah. So we've got wonderful injury prevention programs available. So our good friend Wes Alatar, Dr. Wes Alatar, who's done a significant amount of work with the FIFA 11 plus injury prevention programs, looking at many, many things. He's also taken a deep dive into our injury prevention program effect on foot and ankle problems in mostly soccer players. And we've seen injury reductions around the ballpark once again of about 40%. One study in particular from basketball, adding to this over a 6-season series, even having regular proprioceptive exercises, wobble board, balance board, hop and land drills, perturbation type drills, reduce the injury burden in this professional basketball team over a 6-year period by 80% by having these exercises done on a regular basis too. So really significant effects and widespread. Like, yes, we'll reduce the risk of our king or queen of injuries being the ACL, but the profound knock-on effect of having these programs to the rest of the lower limb is huge.
Yeah, and I think the pleasing thing here is also it's not just one particular exercise that's been highlighted in this research. It's a group of exercises, and I think that's one of the takeaways I'd like to kind of offer at the end of this session is that yes, the Copenhagens, the Nordics, they are an exercise. They're the ones with the research behind it. But as we've discussed, you can have variations on those exercises, and the same goes for those ankle exercises as well. If you don't have access to a wobble board or other people throwing balls at you for perturbations, etc., you can still do a great program with minimal equipment.
Yep, agree. One last one before we move on to point 2 of the big discussion is I want to sort of just change gears a little bit to a different type of athlete where we've seen great effects of injury prevention programs is the runner. The recreational amateur runner. There has been a really nice paper published last year by Leppänen and colleagues 2024. Yep. They did a really wonderful study where they compared a group of core and hip strengthening exercises versus foot and ankle exercises, and they had a control group, and they put these exercises in the mix in a group of amateur runners. And the exercises that had the most significant impact across the board compared to the control group were the hip and core exercises that were performed. Importantly with this one, the caveat was when supervised and when done under the supervision of a physiotherapist. And that effect was around the figure of about 40% reduction in running-related lower limb injuries over a period of time. The foot and ankle program didn't have any effect as compared to the control group, and it seemed to be the hip and the core group that had the significant, the best bang for buck, and that was performed a couple of times a week as well. So a nice little program there to throw to our runners.
We call it proximal strength and stability. And I think that it's really important for that running group. And, clearly this has been on recreational runners, but any athlete of any level, if you're running, I think that they're great exercises to do. And I know that we haven't touched on it. Maybe we'll park it for another discussion, but the same is true for the upper limb. So if you're a swimmer or a tennis player or do anything with the upper limb, throw balls, then that proximal strength and stability around your scapula or your shoulder blade, and then also your rotator cuff, the muscles around your shoulder as well, seem to be really important also. But maybe we'll just maybe I can do that one, Mick. We can talk about that down the track.
We can. Yeah. We've got a few topics to cover. We could have, who knows, this podcast series might go for 100 episodes. We might be able to.
I think we need to do it daily. We won't get any work done, but at least we'll kind of cover it all.
All right. Moving on to so we've covered off all the fun facts and figures, all the numbers about it. So I guess importantly now we sort of shift gears and talk about. We know the programs work, they're very effective, but are there any key components that add to their program success? Have you got any clues, mate? I've got the answers here too, by the way, but give us your educated guess as to what you may think.
Well, I kind of got a reasonable understanding of literature as well, so I might give a few away, but my thought would be that it just has to be done regularly. I think that kind of going back to, like I discussed at the start, where it was in its infancy and people used to do it as a bit of a standalone program and maybe just in pre-season, for instance, that had some effect. But I think that if it's done regularly and as part of normal training year round, that would have a significant impact. Am I right?
You are absolutely correct. You win the biggest
Thank you.
prize money ever available on any prize show.
Thank you.
Yes, that definitely is the secret to success. Ultimately, yes, the stimulus will certainly help. You know, if we're looking at reducing injuries, definitely an eccentric stimulus help. But there's no point having the greatest program in the world if it is not being done. And certainly there was a really nice systematic review done back in 2019 that showed, and to be fair, it was done looking more so at ACL injuries. But the key message here was that having the program done all year round outside of that preseason window was much better for the team and the athletes than just doing it in the preseason alone. So yeah, we need to extend that on a regular basis. The other thing is, yes, regularity is great over a length of time. So, you know, be it a season that goes for, 6 to 9 months, but also to the frequency per week also too matters a lot. There's no point doing that program once a week. You will not get any benefit. You'll effectively, with one dose per week, you'll just maintain what you currently have. 2 sessions to 3 sessions per week seems to be the sweet spot. And if you can tie these programs in around a training session, most even amateur clubs will train at least twice a week, play on a weekend. So we've got up to 3 exposures that we can get into our athletes 3 times a week. And most runners as well will often go for at least 2, if not 4 or 5 runs per week, some even more. But we tie these warm-up exercises or prehab exercises or injury prevention programs, whatever you want to call them, we do them before we actually get out there and start doing our training drills or into the thick of our run. It's quite remarkable talking to runners, especially, who I'll ask, what's your strategies before you run? And it'll be like, well, I'll just sort of go for a 5-minute walk, or I'll just go for a little jog first, and then I'll try to get into my kind of groove. And it's like, well, that 5 minutes could just be better spent, or that 10 minutes, let's extend that by 5 minutes, and let's get a 10-minute warm-up program that you do at home, or you do it in the front yard before you go, and actually get into your groove sooner with a nice bounce and cadence, rather than sort of really slugging it out for the first 15. And yeah, so anyway, that's what I often have the challenge with every day in the clinic.
Couldn't agree more. I think that it's a 1970s to 1980s approach to think that a jog and a stretch before you kind of go out and play sport now is what's required. It's so different. So we should explore that further at some point also.
Yep, absolutely. The other thing that seems to make it a bit more of a difference is the addition of a plyometric exercise, at least one, if not a handful, of plyometric exercises baked within that injury prevention program or your prehab program as well. A nice systematic review, once again, by Wes Alatar, looked at the addition of plyometric exercises baked into an injury prevention program versus a standard injury prevention program, and the reduction in, once again, ACL injuries, but once again, we have seen this in other areas, the reduction of injuries by at least 40 to 50% when the plyometric exercises are part of your program. So it makes sense. You know, if you're going out to play basketball, if you're going out to play soccer, netball, whatever it is, there are regular and constant plyometric demands on your lower limb musculature. So to have something like that that really ramps up your body to handle that springy demand of sport, it also makes sense to have it mimicked in our warm-up plan.
I think that's excellent, Mick. And I also think that we're out of time, but I think we've highlighted some really important exercises, discussed when they should be done, how they should be done, how they can be integrated kind of into a person's program. I suppose just before we quickly sign up, there's a lot of those injury prevention programs are standalone, kind of, like the FIFA 11 plus and those type of things. They're a defined set of exercises. Where do you sit? Do you sit where you just like to take those off the shelf programs, for a better word, and just pop them into an athlete's program? Or do you like to be a little bit more bespoke and kind of just pick and choose and kind of do your own thing?
It's a great question. I do tend to lean on those injury prevention programs that are there because they're there for a reason. What I for a case in point is, say, our good friend Matt Wallen and Stella Veith, who have done an injury prevention program masterclass for us, who are heavily involved with Australian soccer. They've actually evolved the original FIFA 11 Plus to incorporate Nordics and Copenhagens into people's programs because they are highly effective and the research is backing that. So they're there for a reason. So vast majority of time, yes, I would sort of pull the exercises out because they have been put in there. But, and this is the big but, is that sometimes, depending on the athlete sitting in front of me, their injury history, their circumstances, their training locations or whatever, I will adapt them to suit that particular individual. Probably at a broad level, I would sort of pick the programs out, and I'll commonly direct my patients. If I've got an ACL patient or a knee or a hamstring patient who's going back to netball, there are great resources out there on the internet. The Netball Knee, for example, I'll share that information and that website to them. The Perform Plus for football players and soccer players, I share that information to them. The website. AFL Footy as well. The PEP program for our American friends and colleagues. There are so many freely available injury prevention programs out there that I just sort of share those links so people actually can take a bit more ownership with them as well. But yeah, short answer. Yeah, I generally take the exercises off the shelf.
Great answer. All right. Well, do you want to sign us out here?
Mate, I'd love to. So that's a wrap. It's just been a great chat. I like this one. It was one close to my heart. Very, very close to my heart.
We are physios, remember.
We are. So that's a wrap for today's episode of Exercise Matters. If you enjoyed the chat, make sure to subscribe, leave a review, and share it with your mates, please. A quick disclaimer, this podcast is for educational purposes only and is not medical or individual advice. Always seek guidance from a qualified health professional for your specific needs. A big thanks to our sponsors, Premax, high performance skincare for high performance people, and of course our little baby, Learn.physio, world-class education for health professionals. And Randall and I will catch you next time.
See you next time.